Good morning, students. Good morning to all. My voice is audible. Please respond in the chat box. Please respond in the chat box. My voice is audible or not? Students, YouTube live and Facebook live is also going on. Please check it there also. Happy New Year, students. Thank you. My voice is audible or not? Please respond that. Within 2 minutes, sir will join and then the section will be start. Once again, I'm saying to all of you, wish you a happy new year. All our goals will come true in this year. And who had not joined your friends, please let them inform to your friends. Let them join as early as possible. My voice is audible or not? Please respond. Good morning, students. Good morning to all. Please inform your friends. Let them join as early as possible. YouTube live and Facebook live is also coming. Please check it there also. Within 1 second or 2 seconds, section will be start. Please inform to your friends. Let them join as early.
Hello.
Yeah,
Good
good.
morning. Yeah, good morning, Maheshwari. How are you?
Yeah, fine. Once again, I'm wishing to
Yeah,
you, wish you a happy new year, sir.
yeah. Happy New Year to you and to all the participants of this course as well. So just let me know when you are able to see my screen and when should I start. Okay.
Yeah, your screen is visible, your audio is good, and your video also good. You can continue, sir.
All right. So very good morning to all of you, and a very happy New Year to To all the participants who are attending this online course, 15 days course on drug discovery and development. And I wish and pray that this coming year, I mean this current year 2021, would be very safe. Everyone, each one of you and your family members would be healthy, and we will have, I mean, all of you will have a very prosperous year ahead. So, with that, warm wishes, let us begin our online training program. So, drug discovery development today, we will, since there was a gap of almost 3 to 4 days, I would wish that we'll do a quick recap of what we have discussed on last Thursday, and then we will take up further on preclinical toxicology, followed by other topics on general studies for general preclinical studies and target selection, validation. So those topics we'll cover. We'll try to cover as much as we can in today's class, and whatever is remaining, we will continue tomorrow. So, with that, once again, a very warm welcome to all of you. So, in the last class, we have covered in detail about use of laboratory animals, why they are used, which species are used, what are the characteristics of those common laboratory animals used in preclinical research, how actually you maintain those animals, and a little bit about animal handling and pre-toxicology, preclinical toxicology. I think we will cover that in today's class. So last week we have discussed like animals are basically tools for uh, for the investigation. Say for an efficacy study, we are trying to look for the efficacy of our drug. The drug candidate, whether it is able to elicit desired pharmacological action or not. So we have to do efficacy studies. So there also you need animal testing. If you want to study the safety aspect of your drug, which is toxicology studies, so that also has to be done in animals, basically laboratory animals. So that's why we say even for ADME, what we have covered in detail during last few classes, that we talk about pharmacokinetic studies, where we try and understand what drug does to the body and what body does to the drug. There also animal testing is required. So that's why we say laboratory animals are tools for investigation in drug discovery and development research. Why we use animals? Because we already have talked about it, that they're suitable alternatives to human systems, because the one thing is they're live systems, right? And as we all have understood that thousands and thousands of molecules we try to screen before we actually come to one efficacious and safe drug into the market. We are able to launch that into the market. So all the drugs which are under screening, which are under evaluation, cannot be tested in human. That's why we test them in animals. And yes, they do have similar organ systems, metabolism. They do express metabolizing enzymes in intestine as well as in liver, as human do. So that's why they are used as preclinical screening species. And most importantly, whatever data we obtain from these lab animals can be extrapolated to larger species and eventually to human. So that's why we use animals. Also, we have seen that there are a lot of welfare, animal ethics uh, issues also related to usage of animal in research. But we all have to understand that yes, of course, there are alternatives to animal research, animal testing, but completely we cannot really remove animals from drug discovery and development. And all this, as if this is just an example, young girl suffering from kid suffering from cancer. So for oncology research, for diabetic research, and all the disease which a human can suffer from, all that research is going on always. We always are busy trying to get a breakthrough, a new breakthroughs for treatment of such dreadful diseases in human. So that's where animal research is of paramount importance. I mean, usage of animal research, and we simply cannot replace that with anything else. We can definitely reduce indiscriminate usage of animals. We can look for alternatives, but to completely remove animals from the entire drug discovery development process, I don't think it is possible, at least as of now. So, few examples then we talked about last week that many, I mean, more than almost 10 lakh children under the age of 5, they survive each year from from accidental exposure to potentially poisonous substances, right? Like that, many Americans are diagnosed with cystic fibrosis. So this is just to showcase like prevalence of disease, as we can see in a most recent way, pandemic crisis situation, even you can see COVID-19 is there, right? So like this, every now and then one or the other disease keeps on coming, keeps on attacking human race. So that's why we are always busy doing research to come up with novel drugs, and that's where animal research plays an important role. What are the major species, most common species which are used in research? So rats, mice, and other rodents. So these are just a few examples we had discussed last week, like diphtheria, typhoid, cancer, bone research, skin transplantation, penicillin, all this research, all these areas where we got a breakthrough using laboratory species, rats, mice, and other rodents. We started with mouse. So mouse, very timid, gentle, easy to handle, very small, beautiful species. Is as the scientific name is musculus, and lifespan is around 1.5 to 2.5 years. At birth, their weight is around 1 gram, and by 13th day, they completely open up their eyes and they are able to. They can eat also, and they are generally maintained in polypropylene cages in a group of 1 to 3, so that the social environment is provided to them, and environmental conditions are same as we have discussed last week across species. Mostly it is 20 to 25 degrees Celsius, relative humidity of 30 to 70%, and light and dark cycles of 12 hours minimum is what is their environmental requirement. And all these requirements are in detail, very well explained in CPCSCA guidelines, which is available on net. You can just Google search the guideline and you can download the document from CPCSA website. Nutrition, those mouse pellets, feed pellets are available, which has to be given ad libitum. Unless you have a specific protocol where you need to control the diet, you can just give them ad libitum, the pelleted feed, which is available in market. And there are so many vendors who sell this feed pellets, and their composition is also defined, where there is a fixed percentage of protein, carbohydrate, and other nutrients are already added in those feed pellets, and where they're used. So as we have talked about, their usage is in pharmacology, for efficacy studies, for safety, toxicology studies, carcinogenicity, teratogenicity. In disease diagnosis and behavioral studies, we use mouse. So same way, another species which is equally prevalent as mouse is rat, which is Rattus norvegicus. We call it a scientific name. There are popular strains. Of course, I didn't talk about the strains of mouse. So in mouse, there are strains like CD1 mouse, Balsi mouse. So these are the common strains which are used. For rats, the commonest strain which is widely used is Wister rats and Sprague Dawley rats, and the lifespan is around 3 years. Their birth weight is around 3 grams, and by 16th day they can even by 13th day they open their eyes, and by 16th day they can start feeding. So their maturity period is 7 weeks. Environmental conditions, as we discussed, as per the CPCSA guideline, they are coprophagous. So coprophagous means they can eat their own species. So we always have to make sure that they are fed well. Okay, and they are also used very commonly in doing efficacy studies, in studying the safety profiling studies, and disease diagnosis, as well as behavioral studies. Then we talked about guinea pigs. Again, gregarious, very active in day and night, and male weigh around 400 grams, female are more bulkier, around 650 grams, and they can be maintained in a floor pans or a large cages, but you need to provide a bedding material. Environmental temperatures from 18 to 26 degrees Celsius outside temperature, and relative humidity again 30 to 70%, and light and dark cycle of 12 hours minimum. In their nutrition, whatever feed we serve, we have to make sure that at least 10 to 15% should be of fiber, 18 to 20% feed should be protein, comprise protein, and there should be vitamin C supplement additionally if you're maintaining guinea pigs. And they're used in TB, anthrax, leptospirosis, and other disease models can be developed using this species of animal, laboratory animal called as guinea pigs. Going to the larger species like cattle and swine, again for smallpox, organ transplant, diabetic research, heart disease, arthritis, osteoporosis, they are very commonly used. Another very commonly used species in preclinical research is rabbits. Now, rabbits for rabies vaccine, even for antibody production, cholesterol studies, they are used indiscriminately. The scientific name is Oryctolagus cuniculus. Okay, and the most common species strain of rabbits is New Zealand white, but Soviet chinchilla is also another species. But most commonly used rabbits in preclinical research is New Zealand white, and then the breeding age for the female is 4.5 months. For male, it is 6 months. They're induced ovulators, and their litter size is also 6 to 9. So when they give birth, minimum 6 to 9 young ones are born. Environmental conditions again 16 to 20 degrees, relative humidity 40 to 60%, and light and dark cycle they need slightly more, that is up to 14 hours, and then another 12 hours of darkness. And again, their feed should comprise of 12 to 22% of fiber. Protein should be 12% for maintenance, and for growth, for the growing rabbits, you can keep up to 15 to 17% of protein. And where are they used? We already talked about it in ophthalmology, in cardiology, hypertension, virology, embryology, serology, all these studies in all these areas, you can use rabbits. Then slightly higher species, we talked about dogs, especially beagle dogs. They are meant for preclinical testing of drugs. And they are again they are bred especially for research purpose only, and they are called as beagle dog. The diagram, if you see the lower side, the dog which you can see with patches, that is how a beagle dog looks like, and they are also used indiscriminately for research purpose. After you do your initial studies in laboratory animals, we always want to go for one higher species before we extrapolate the data to human. So dogs is one of such species where ADME safety and toxicology studies are being done. Then we also talked about, we will cover in detail about zebrafish going forward. So it's also one of the very, very beautiful model in preclinical research, less than 24 hours of life cycle. They are transparent in shape, so all the organ systems are visible with the naked eye or at least under the microscope. So you can beautifully observe the entire process, what's going on inside the body, at least with naked eye, and the entire life cycle is very small, very less, so we can study the effect throughout. So zebrafish is one very important model in research, especially for toxicology studies. And we talked about non-human primates. Yes, chimps are very closest to human, as they are our ancestors. Human have descended from monkeys, chimpanzee. So they are anatomically they are very close to human, and sometimes uh, along with beagle dog, or if you're not using dogs, you can do studies in chimps. But not all the facilities across country have permission to use that. Hardly there are few academic institutes and few private contract research organizations who have permission to use chimps. And I think Zydus is one private CRO who is having a chimp facility in Ahmedabad, Gujarat, and they do studies in chimpanzees. Same way, IAC, I think Indian Institute of Science in Bangalore, they have, it's an academic institute, and they have one of the premier research institutes, and they have also a chimp facility, and they also do studies in chimps. So, in summary, hamster, gerbil, bats, dogs, cats, Homo sapiens, birds, all of the species, their usage in different areas is enlisted in this table, as you can see. But from smaller species to higher species, Homo sapiens, we being uh, the dominant species, we have this advantage over lower species, and that's why we use all of them for research purposes, and we use that data and try to extrapolate it to human, so that usage of human or testing of every drug in human can be avoided. So that is one advantage we have of being a larger species and on the top of the cycle of these animals. Yeah. So basically, the advantages of using lab animals: they are small in size, so easy to handle. They are reliable in controlled environment, as we have seen that the environmental conditions can be controlled very easily. So that is a biggest advantage of using these lab animals. The genetic purity is possible. As you can see, we can have knock-in, knock-out animals bred. We can do the induced, intentional changes and do a mutation, and we can have a modified, genetically pure breeds of animal, because their life cycle is also less than human, and they are small in size, under controlled environment conditions. They can be maintained. So these are all the advantages of using laboratory animals. And controlled breeding. So even breeding can be controlled in this animal. So these are few advantages why we use animals. And what are the research areas which involves animals? All of you have by now understood that yes, in drug discovery, especially to understand the absorption, distribution, metabolism, and excretion, pharmacology studies about vaccine, and in diagnostic areas for doing potency testing, for doing safety testing, all these things we use lab animals. From safety perspective, you can do toxicity studies, you can do chronic toxicity studies, we can do specialized toxicology, especially carcinogenicity, reproductive toxicity, genotoxicity studies, irritation studies. All these things can be done in animals. Even for testing of agrochemical, cosmetics, all these things can be done in animals. So for environment and ecology also, aquatic toxicity and chronic toxicity are being done. So, from a veterinary perspective, so far whatever we have talked about is from a perspective of human drug discovery and development. What is the role of animal research? Same way, even in for a veterinary drug approval process, animal studies are obviously very important, right? So this is just an example. So I no need to get into detail of that, but even for a veterinary drug approval for animal usage, you need to do in vitro studies. Yeah, you need to have a disease models for in vivo efficacy studies. You need to do absorption, distribution, metabolism, excretion studies. Then you do the safety studies, and then only it goes for registration phase. So just trying to compare a drug discovery approval process, drug approval process in human is same as in veterinary drug approval process. So you can see INDA, major there are 5 technical issues of slightly different than human, is because animals, of course, target animal safety is important, because that's where you're going to use your drug. The efficacy of the drug is very important, but for animals, not for all, but few animals, human food safety is also very important, because many of these animals serve as a food for human. So human food safety is also equally important. And CMC plays an important role: chemistry, manufacturing, and control. And since all of this animal, they urinate and they defecate in open, so finally whatever drug is there, either as unabsorbed drug or as a metabolized drug, is released back to the environment. So the environmental impact also needs to be studied for the drug which is meant for veterinary use. So that is slightly additional, and the human food safety which is not there for human drug approval process, but for animal drug approval process these two additional things are there. So if you want to study more, you can go through this site and you will find VICH guidelines, especially for veterinary. V stands for Veterinary International Conference of Harmonization. So VICH guidelines for conducting studies in animals for veterinary drug testing. About ethics of animals, yes, to meet the noble desire to treat all animals, ethics is must. Whether you do safety or efficacy study, please try and be ethical. Okay, as a couple of, I mean, we all know that we should be noble to all the living things. So yes, we have to utilize them for our own benefit, which is for drug research. But at least try and provide them an ideal, optimal conditions, right? So that they are comfortable and they have a very good environment, micro as well as macro environment. At the same time, from the welfare and ethics point of view, it is fine. But the data which you get from such animals is also very authentic, and you can rely on that data if you have provided them in ideal conditions. So ethics and welfare is equally important for human, because the data which we're going to get from such animals will be extrapolated for human studies, right? So that's why it's very important to provide them in ideal conditions. Okay. So in terms of regulation, as I already told you, committee for of supervision, committee for prevention of cruelty, supervision of experiments on animals, which is CPCSCA, which comes under Ministry of Forest and Environment. They actually restrict and approve the usage of animals. Okay, so it's a statutory body under Ministry of Environment and Forestry, and every institute or a lab or a contract organization, whosoever wants to maintain animals, their facility should be registered with CPCSCM. Okay, so CPCSC, what they have done is they have, as per their guideline, each institute or a lab needs to have institutional animal ethics committee, which should comprise of minimum 8 members, right? So at our institute level or a college level, there should be an IAC committee which will be comprised of 8 members. The chairman of the institute is generally the chairman of the IAC committee. There will be 2 biological scientists, 1 laboratory animal house in charge, a veterinarian, external scientist, CPCSA nominee, and a link nominee which will be nominated by CPCSA directly, and 1 socially aware person. So this entire 8-member committee is responsible for review of every protocol at your institute, college, or university or lab for usage of animal. So you need to justify the number of animals to be used and why you want to use and how exactly you're going to handle those animals, how you're going to dispose those animals, how you're going to generate significantly statistically significant data out of it. Everything needs to be written in a prescribed format called as Form B, and we have to submit to this committee. This committee will review, and upon satisfactory review from them of your protocol, you get approval to conduct the studies in animals. So since CPCSC representation is there on this committee, they are the authority to take the call on small animal laboratory animal protocols at their level itself. If there is a large animal usage, then this committee has to forward the application after review to large animal committee, which is centrally managed by CPCSC. Okay. So that's about regulations. Then we talked of role of CPCSA. So the most important is to come up with a guideline which is already there in place. In the guideline, in detail, they've explained about animal housing, about management, approval process, how you can actually register yourself for breeding, and then how you can register your animal facility. They're also important job. One of the important job is to scrutinize every research program to approve animal usage. And finally, their objective is to minimize and rationalize the animal use in experiments. So there is a concept of, as we have discussed last week, 4 Rs in CPCSA. We call it as a replace wherever possible. We are in detail. We have talked about alternate techniques using hepatocyte, enterocytes very early in drug discovery. Those are means and ways how you can reuse in vitro cell-based models instead of using live animals. So that is replace. You can always reduce, like indiscriminately using hundreds of animals just because we got access to laboratory animal doesn't make sense. You should always use only number of animals which can answer your question, a specific question which you're trying to answer through that study. You should use only those many animals. At the same time, make sure that at least you should have a number of animals which can give you statistically significant data. So instead of repeating that experiments again, at least make sure that you can use number of animals which can give you statistically significant data, whatever positive negative data comes out of the study. So that is how you reduce animal. Refine. So basically we say that use painless procedures wherever possible. Some studies it may not be possible, but wherever possible, please reduce the pain which we elicit to animals, right? So you can use analgesics wherever possible. Of course, you have to keep in mind that there should not be any interaction of that analgesic or antibiotics which you're going to use with the drug candidate. So that you have to make sure, but wherever possible, please make your process painless and minimize the stress on animals by giving them good feed, good quality water and bedding material, and a good environment, temperature condition, relative humidity, maintain controlled environment conditions will give them less stress. So please follow these 3 R's, and the fourth R is redundancy. Wherever possible, if you can reuse the same animals, at least you can further avoid using newer more animals for your research purpose. So sometimes, not always, sometimes it is possible when your studies are small, when the small doses you use of your drug candidate, you can look for after 7 or after 10 half-lives of the drug, when you are sure that almost all the drug has come out of the body, same animals can be utilized for testing PK studies or ADME properties determination of some other drug. So that is fourth R. So this is the concept of 4 Rs in CPCSEM. And then management of animal house. So we already talked about good quality animals. So healthy, optimally grown, they should be devoid of any latent disease or infections, because any such infection or disease in animal will affect the data which you're going to get from those animals, be it efficacy, be it toxicology, or be it PK studies. So we should make sure that there is a freedom from hunger. They should always be fed ad libitum, which is sufficient food. They should be free from stress. As long as possible, avoid any pain, and then they should be well supplied with water, fully sterile water bottles, so that freedom from thirst and freedom from disease. So these are the few things which CPCSA always encourage. And otherwise also we should maintain. Environment, we already talked about temperature. You can consider it as 23 plus or minus 2 degrees. Humidity 30 to 70%. Light at least above 350 lux. Noise level not more than 80 lbs. Air exchange around 15 to 20 air exchange per hour. So this is the parameters well defined as long as environment of a laboratory animal is concerned. So when you go back to your college, when you go back to your university and visit the animal facility of your own college or university, please look around if these principles are being met, these standards are followed or not. If not, you can bring to the notice of your related concern, relevant concern department or head of the departments. Housing types we talked about, they can be conventional. So like you feed them, you groom them, you vaccinate them against common disease, but you do not house them in a typical room. So that is called conventional. Basically for large animals like sheep, goat, dog, pigs, they are kept in a conventional housing types. There is a barrier housing where, like as I was talking about, specialized cages like stainless steel racks are there, and then in that there are cages. In subsequent slides, we'll see the picture of that. Cages are there, and then you have to use a sterilized bedding. The room air, as I generally say, that animal facility should always be minimum class 1 lakh facility. What is class 1 lakh? Whatever air is entering inside the room should be filtered through filters or at least zero point 0.5 micron HEPA filters, and whatever exhaust air is going out of your facility should also be filtered through zero point 0.5 micron HEPA filters. So that is the sterile environment you maintain in a laboratory animal. And then barrier can be a cage, a room, or even an entire facility. Guard against the infection or keep the disease causing organism away uh, from getting out. So how do you do that? Because you already have a HEPA filters there. So you make sure that a sterile environment is always maintained 24/7, 365 days in your animal facility. Then we talked of bedding material. Okay, before that barrier, then we caging. So about the caging system must provide animals with comfort and safety. And I must tell you that when you refer a CPCC guideline, all these things are very well defined there, and in detail they have explained how much space is required by each animal species. So accordingly, you can design the caging system also. Stress free environment should be there. The polypropylene cages nowadays, they are transparent, so you can see through those cages. Of course filters can be maintained, and there is another way of maintaining the animals, that is by IVC cages, individually ventilated cages. So each cage can have its own microenvironment. So each cage can have a HEPA filter. So you imagine you kept 3 rats, or I mean 5 rats or 3 mouse or whatever inside. Whatever air is coming out of that is also sterile. What is going inside is also sterile. So now you have a room which is a outside macro environment. Now you have a micro environment within the cage. So that is that can also be controlled. So those are the best ways of keeping animals, that is individually ventilated cages. Bedding is a part of the environment for the animal's microenvironment. So whatever absorbent material you use should be sterilizable. And what are the general things we use as a bedding material? That is paddy husk, corn cob, paper shreddings, wood chips, wood shavings. So these are all the, and corn cob. These are all the normal bedding material we use generally in cages. And equipment sanitization, you should have cleaning procedures, hygienic sanitization procedures to be followed in the animal room, especially in the animal facility. So cleaning should be remove all the visible surface soil, reduction of bacteria. If you use a disinfectant, you should use disinfectant every now and then. More intense form of sanitation to reduce the harmless level of number of specific types of organisms, right? So there should be procedures like morning, evening cleaning using a disinfectant should be done in your animal facility in each and every animal room. And of course sterilization is very important. You should always do sterilization of every equipment you use in animal facility. Even for cleaning procedures, always maintain a protocol. That is, you should always clean the cleanest room first, and from there you go to the dirtiest room. So that, and each room essentially should have a separate cleaning materials like broom and everything should be separate, the bucket which you use for cleaning, so that contamination doesn't travel from one room to the other in case there is any accidental contamination in your facility. So all those things you should always maintain and plan ahead of time while working in an animal facility. Then we also talked about environmental enrichment. It's very important. As we already talked about it, the data which comes out of these studies are going to be used for extrapolation, allometric scaling into human. So we want that they should be very comfortable and they should be stress free. So in order to make them stress free, we want to give them enrichment. So as it says that in mice and rats, you can give them some tunnels you can keep inside, right? Some boards of purchase can be kept there so that they can play around, because they have a burrowing behavior, rats and mice. So they like to bite the stuff. So if you keep them such things inside, like toys kind of thing, in form of tunnels or stairs and all, so they feel really comfortable and they are highly active. So when you talk of even same is the case with beagle dogs or even larger species, even for rabbits and all, you can always keep material for what do you call for enrichment. And as I said, enrichment, so far there has been uh, debate going on, because there are papers which suggest that by giving enrichment we get better data, and then there are papers which suggest that just by giving them enrichment there is no significant difference in the data which we obtain out of the studies. So it is very difficult to say whether we should do enrichment or not, purely from a scientific perspective, but that is still a matter of debate. But I would suggest, in general, whatever little enrichment you can provide and increase their comfort level, I think we will have a positive impact on our data, the study data also. So I personally feel we should provide them with bare minimal enrichment wherever it is possible. So we should have a very stringent health monitoring system in our laboratory animals. We also discussed about that. We want them to be free from viral, bacterial, fungal, or parasitic infections. So diagnostic methods are there in place, which is ELISA, IFT, PCR, cell culture. So all these things can be used to identify if your colony is suffering from any contamination, and then you can isolate, quarantine that animals or a group of animals, and then take further action so as to restrict the further spread of contamination across the entire colony. So, what are the precautions we should take while handling an laboratory animal? Because we should always be careful that animals can transmit disease. We all know it very well. There could be an allergic individual, so there are like very small fur coat particles which comes out of their fur coat, and that can also make us allergic. So if there is any immunosuppressant worker who is working, he should be also careful while working with animals, and we all should avoid any injury from a bite of animals. Like, they're very sharp incisors, especially mice and rats. So we should take care to avoid that. As I mentioned, every person who works in an animal facility should have bare minimal two vaccinations. One is tetanus and another is hepatitis B. These two vaccines we should definitely take before we start handling the animals. What are the common allergens? So fur, urine, serum protein, these are the just uh, common allergens, right? And from where do they come in contact with us? How do we get exposed? Through bedding, because they're going to urinate, defecate in the same bedding material. So while you're handling that bedding material, it comes in contact with us. While we are collecting the samples, blood samples, tissue samples, it can come in contact. While we are actually dosing the animals, we are handling the animals, or while we are throwing that bedding material, dumping of the litters, that also can lead to exposure to our exposure to this allergens. So what are the disease? Basically, contact urticaria, allergic conjunctivitis, rhinitis, asthma, anaphylaxis. All these are the symptoms which can happen to us if we are handling animals. So we should always use preventive measure. As we all know from a COVID environment also, prevention is better than cure. Now that vaccine has come into place, we can use vaccine, we can get vaccinated and prevent infection, getting ourselves infected with COVID. Same way, there are preventive measures, like you can use respirator, you can use mask, protective gear like apron, helmet, face mask. You can use goggles, gloves, all those things should be used to prevent any infection coming from animals, laboratory animals to human. So these are just few examples we have shared last time. You can go through whenever you get time. Lab Animal Science 1996, one article where it is mentioned bites and injury incidences in US alone. Of course, we should maintain all the principles to be followed for biological waste disposal, which include sharps, which include animal excreta, which includes blood coming or the liquid, any body fluid coming out of animals, uh, the carcass of the animal, the tissues of the animal, all those things should be handled very carefully and as per the guidelines for disposal of biomedical waste should be followed strictly. These are just the list of zoonotic disease that can come from different animal, like the disease which affect multiple animal species like rabies, salmonellosis, giardiasis, disease which primarily affect non-human primates like herpes B, tuberculosis, shigellosis, amoebiasis, which primarily affect sheep's coats, or contagious ecdyma, which generally covers their mouth and feet. Both are affected. That's called contagious ecdyma, very common in sheep and goats. Q fever. In most important for us is the one which primarily affect the rodents, lymphocytic choriomeningitis, rat bite fever, or hantavirus. So these are all the list of zoonotic disease we should always be careful about. So how do you avoid, apart from using protective gear, please wash your hands. This is the bare minimum thing anyone can do while working in animal house. What you need to do is before beginning of the work, you should at the end of the shift, you should wash your hands before entering or leaving any room, after handling the animals, after removing your gloves, after completing any surgical procedure or an animal intervention procedure, you should wash your hands. And after any suspected contamination, in case you have come in contact with anything, immediately you should wash your hands. I already mentioned waste disposal. Please follow the guidelines for biomedical waste disposal. All those university, colleges, or facility where you have incineration facility available within your campus, you should make sure that that is completely followed for every carcass which comes out of an animal facility. So in a nutshell, you should properly dispose the animal waste in bedding, because not only our uh, chances of exposure to disease are more, but since if you don't follow the rules of biomedical waste disposal, you may dispose it in the environment, and we may contaminate the environment, and other people can get zoonotic disease. So that's why waste disposal should be done very seriously in animal facility. Protective clothing, personal protective equipment, always you should use. We already talked about. Also, uh, it's like earlier there was a period when it was considered that only veterinarians, like people who had done BVSc and AH and masters, or veterinary science, which the people who have studied, can work in animal facility. But now it has opened up the opportunities for everyone. I would say the scope is there for different discipline people, like nutrition. Your background is biotechnology, genetics. You can also be a part of the breeding. If you're from microbiology, you can be a part of a health monitoring team. Genetic model developments, again biotechnology comes into the play. So all I'm trying to say is it's not only a science for veterinarians, but even a biotechnology, a pharmacology, or a pharmacy student, or biotechnology or a microbiology student can very well work and contribute in animal facilities of any institute. Okay. So there is a dire need for a trained people in academia as well as industry, and that's why this is just few places I have mentioned, like PBR, Indian Institute of Science, and NECLAS in Hyderabad, NIAW in Haryana, National Institute of Animal Welfare, ECTRACT in Mumbai, Tanuvas is a veterinary university in Chennai. They all offer courses in laboratory animal training. Okay. So what is the take-home message? What we have discussed last time is animal use is indispensable. in biological as well as medical research. We can reduce the indiscriminate usage of animal, but we cannot completely avoid usage of animal. Okay, from a simple research, it has grown into a specialized science. As I already mentioned, that this different disciplines can now really contribute in animal research, and humane ethical attitude is a primary requisite. As I said, apart from whatever benefit we're going to get from animal, please consider them as a live system, and please pay them that respect which they deserve. So at least follow bare minimal welfare and ethics practices also while using laboratory animals in your research. And there's enormous scope and opportunity in academia and industry for laboratory animal science. So if at all you are from pharmacology, pharmacy, biotechnology, microbiology, or from a zoology background, you have a great scope in industry as well as academia, especially in animal science. So with that, I think our recap is over, and we can really now get started with our next topic where we stopped last time. That was on preclinical toxicology. So I will try to talk about animal handling. Okay, I'll walk you through how exactly very simple procedures. Of course, not a live demonstration, but through pictorial things, we will talk about animal handling. What are the very common route of administrations they are used? What are the recommended samplings? Can you really collect almost entire blood from the animal, or there are any rules and regulations, right? And then we will get into target selection. This is from a drug discovery point of view. How do you really select your target? How do we validate? How do we really do a lead optimization? What are the general studies, like, which include pharmacology, toxicology, PK studies? What are those studies? And then we will try to introduce the concept of good laboratory practice, also known as GLP. So I'm not sure if I'm able to cover everything in today's lecture, but we'll try and see what all thing can be covered. Remaining, we will try to touch base tomorrow. Okay. So in preclinical toxicology, let's first understand what is toxicology. All right, thank you. So, sorry for the slight delay. Okay, so for toxicology, toxicology has come from an ancient Greek word called toxico or toxicos, means poisonous. Okay, so when you try to study this, this is called toxicology, and it is derived from a word called toxicos. Of course, it's a branch of biology, chemistry, and medicine, right? But mostly it is always related to pharmacology. So what actually is covered within toxicology? So it is concerned with the study of adverse effects of chemicals on a living organism, right? So concerned with the study of any adverse effects which you may see because of usage of chemical, which could be as a drug, or which could be a topical application, or any contact of within that chemical, or even inhalation brings about those adverse effects on a living organism. When you try to study that, it's called toxicology. Okay, so what all things we'll try to cover. So when we say from a preclinical perspective, we do toxicity testing, right? That is acute toxicity, as the name suggests. They are quick, small duration, acute toxicity. Then there are subacute and subchronic toxicity studies. Then there are very long-term studies which are termed as chronic toxicity studies. There are mutagenicity studies. There is ecotoxicological test on terrestrial animals, and then ecotoxicology on aquatic organisms. Okay. So I won't spend much time on it, but later on, when you get time, you can go through all of them: WHO, ICH, USFDA, Schedule Y, JMF, EMA, EPA, OECD. These are all the regulatory agencies, regulatory framework in different countries. So based on which country you are trying to submit your data, you may have to follow this guidelines. If you want to submit your drug for approval or a vaccine for approval for WHO, then you have to follow their guidelines. If you want to give it to USA, then it has to be USFDA. Of course, the USFDA also follows the ICH and OECD guidelines. India is also one of the OECD member now. So data which is generated here would be acceptable in all the OECD countries, like EMEA for European Union. This is for Japanese. So like that, different country-wise or region-wise, they are separate regulatory agencies. So in your free time, try and read about them. We will, in our discussion of next 5 to 6 days, we will definitely cover about ICH and OECD guidelines, because they are most widely accepted and applicable guidelines for drug discovery and development. So, what is an experimental animal? We have talked about species, strains used, but experimental animal can be any live vertebrate animal used or intended for use in research, testing, or teaching is called experimental animals, right? What is a laboratory animal? I'm sure all of you can answer this now. This refers to any animal bred or maintained for use in animal experiments, including those during transport to the facilities, right? So, what we have to understand is basically we try and see that what all of us should understand is, see, laboratory animals, they are they are met for they're meant for experiments only. Okay, so I'm saying from an ethics point of view, because many a time people do argue that we should not use animals in research. So the point here is, these animals, if they are not bred, they are not they are not produced for research, then in any case we are never going to keep these animals in open, because they are specially meant for research purpose. They are bred and they are maintained in a laboratory animal. So in other words, what I'm trying to tell you is, these animals are born in laboratory and they die in laboratory. They're never going to see the outside environment. So that's why they are called as experimental animals, laboratory animals, and their purpose itself is for animal experimentation. So please do not think too much from an animal welfare. We should always think but from an ethics point of view, that why animals. So we are not really hampering their life at all. They are born in laboratory and they die in laboratory. Okay. So what is an ideal animal model? See, if you have a circulatory system, their vital processes you can see. Uh, that is one of the important thing. The similarity, again, is as similar to as human. Data, if it can be extrapolated to human, if we are able to reproduce that a species, we can do many reproduction, toxicity and all. How easily they are available, right? How easily they are tractable. What is their size? Are they easy to handle? Say, for example, can we really use elephants? No, because it will be very tough to handle those. So size also matters. What is their lifetime? We already talked. All of them are within 2 to 3 years is their entire lifespan, and so we can study the long-term effects also. How easily they can be maintained, and most importantly, are they inexpensive? Right? You cannot use animals which are really very expensive. Of course, you'll be surprised these laboratory animals are also very, very costly. I talked about SCID, severely compromised immunodeficient animals. So those are also very costly animals, 4,000, 5,000 rupees for just one SCID or nude mice or rat. And generally, just for your understanding, a normal Vista rat would cost you around 250 to 300 rupees, and a mouse CD1 or a bulb C mouse will cost you around 150 rupees to 200 rupees. So that is their cost. But specialized genetic models, if you try to obtain, then they cost you higher. So these are all the advantages of an ideal animal model. You can see, which really makes them easy choice for us for screening of compounds. What are the general, no need to spend, all of you now have very well understood this. Mouse, most common species are CD1, Swiss albino, bulb C, Vista rat as sprague dolly rats, guinea pigs Hartley, rabbit, most common is New Zealand white. In dogs, the species is beagle. I'm sure all of you are well aware because we have covered this in detail. For ecotoxicology, Japanese quail, fish, honeybees, Daphnia, earthworm, algae, these are all used for ecotoxicity. Alternatives, again, no need for these slides at all because we have discussed this in much detail. You have a lot of in vitro assays, especially hepatocytes, especially enterocytes, which can be used for alternatives to animals, right? Okay, one second. Apart from alternatives, what they mention is when you're using higher species, you can definitely use lower species, right? Instead of using hundreds of dogs, please use rabbits. Instead of using thousands of rabbits, please use rats, mice, right? So these are all the techniques available. Even human models are available. Mathematical modeling of physiological processes is available. You have we will be talking about quantitative structure activity relationship analysis can be done, like softwares are available where QSAR can be done. We'll have a separate lecture where we'll cover about QSAR and other mathematical model, computer aided drug design. So all these things can be employed early in drug discovery stage, where so by doing that we can reduce the number of animal usage. Housing, no need to spend any time because all of you have understood. Temperature, 23 plus minus 2 degrees, humidity 30 to 70%, air pressure, air exchanges, light intensity, specific pathogen free environment, socialization, environmental enrichment, and animal welfare. All these things to be kept in mind while designing the housing of experimental animals. So let's move our gear and get into animal handling. So as you can see, this is a rat, right? Looks like a or a mice. Uh, Maybe you can see a stainless steel grill. This is the food pellet, how it looks like, and this is not advisable. Okay, although in couple of pictures I have seen, we are holding it with a bare hand. Okay, so please do not do that. Always wear gloves. So animal handling, always you should wear gloves. Okay, and this is how it looks like. Of course, we try to handle the animals from their tail. I personally feel it is not good, and then you can hold the rat instead of making them hang through their tail, okay, which is not good. So this is the way how you hold it. This is a mice, and again, always wear gloves. This gentleman is not wearing gloves, but we should wear gloves. And there's a fluff of skin available right above the between the ear. You have to hold that, and then you can take it in your palm, and you can then dose the animal. So he's trying to dose the animal, so he's trying to lift hold it properly. So with one end you are holding the tail, and with the other hand just take this excessive skin in your between your thumb and index finger. So now you can easily then put it against your face. So like that you can lift, and then it can be dosed. So this is the position, and they are also very smart. Generally they will grip, they will hold the stainless steel grill. So you have to be careful, don't be aggressive, but very gently you have to make them remove the grip from the grill. Otherwise they may get injured, and there could be some small injuries in their hands or legs. So this is how you hold a mouse or a rat. As I was telling you, after you have a grip between your thumb and index finger, you can now flip it around. So now he is comfortably resting on your hand palm, and then you can stretch, you can pull the skin which is in between your index finger and the thumb, and then you can dose the animal, you see. So now even this can be used to give the intraperitoneal injection somewhere here. If you want to give them oral intubation tube, you can pass through this. So this is an ideal, and under your last two fingers, the little finger and the ring finger, you can press their tail, but gently. You have to be very careful in handling them. Okay, so this is how you hold an animal for dosing. And as I was telling you, never lift. I see this in many colleges, even in companies, research, contract research organizations. People simply lift the animals from the tail. I would simply say that please compare this against your own experience. If somebody tries to lift you from your leg, we really don't feel comfortable, right? So same way, if you lift them from the tail, their entire body is leaning downwards, in which is not a good preferred position. Instead, just very gently put your hand inside the cage and hold them between your thumb, and rest 3 fingers or 4 fingers can go beneath their abdomen, and you can easily, and they will never bite, because they cannot really bite you from 180 degrees backside. So one tip I would like to give to all of the participants is always handle it from behind, okay, and stay away from their mouth, because their two incisors are very sharp. So as long as you're away, they cannot really bite you. So you have to be a little careful, and that's why I said that you should always take tetanus injection also prior to handling animals. Okay, and please, this gentleman is not wearing the gloves. I would recommend that you should always wear gloves. This is the bedding material I was talking about. The paper shreddings, it looks like, or a wooden chips. This looks like paper shredding. So this can be the bedding material. And as also mentioned that it gets dirty because animals urinate and defecate. So this is the feces from animals. So just to give you, this is the bedding material actually I was talking about. And then you can actually hold, this is also a holding position where you press the thumb and the index finger slightly and take their legs ahead of your thumb. So what happens is, now they cannot bite you, but you can now dose them intraperitoneally or intramuscular. Any injections you want to give, you can give them, and from mouth you can pass on the feeding intubation tube. Okay, so this is how you handle a rat or a mice. Okay, for a rabbit, again, very gently, very carefully you have to handle the animals. You see, this is the best way to handle the animals. Below the leg, below their thighs, kind of thing, you can keep your hand, and the other, like a baby, if you lift them, they really feel very comfortable. So this is the ideal way of lifting the rabbit from a cage of a rabbit. Okay, as you can see, this is another example that holds true for the dogs also. You very gently you can hold them from the thighs, and like a baby you have to lift them. And I have seen this practically. I have actually experienced this. When you handle these animals like this, you really feel very comfortable. In fact, I can tell you, because you will be wearing the gloves and apron and everything. If you just take it and put it on your hand, they really feel that caressing, that caring nature or the handling really makes them comfortable, and that's what we call it as making the animal stress free. But if you are aggressive, or if you're not careful in handling, even they become disturbed and they become slightly more aggressive, and they may bite you also. So that's why always handle them with care, in a caressing manner. Okay, just like a baby you lift, can lift rabbit or dogs. This is about handling of animals. So what is a good experimental practice? Basically, administration of substance and removal of blood, including roots and volume. So let's cover this. So what do you mean by dosing? Okay, so dosing is nothing but, for a variety of scientific investigations and to meet regulatory needs, we need to dose the animal with a drug. Basically, when you take a paracetamol or a brufen or a cetirizine tablet, we are just taking it orally as a tablet form with water. We gulp it inside. That is dosing. Now, animal cannot do this on their own. We have to dose the animal. So that is the process is called dosing. It could be orally through an intubation tube. We'll see a picture later, or it can be an intravenous injection or an intramuscular injection, subcutaneous injection, or intraperitoneal injection. Whatever route of administration you try to administer drug into animal is called dosing. Okay. What is the dose volume? So based on the dose concentration, chemical physical property of substance and species of animal, dose volume is decided. So what does it mean is, see, as a human, we take one tablet of say 500 mg, and you can gulp. Some people will take hardly 2 sip of water and they can take the medicine inside. Some can take one full glass of water. Somebody can take half a bottle to drink that water. So what happens is basically that much volume is getting inside your stomach. But you can take that dose volume based on capacity of your stomach, right? You cannot just drink 2-3 buckets of water. So that is defined. So same way when you are trying to give drug to the animals, the dose volume is defined based on the volume, surface area availability within their stomach and intestine. We can only dose limited amount of volume. At the same time, when we give intravenous or intramuscular, the dose volumes are defined. Okay, that how much dose volume can be given. More than that volume, you cannot administer into animals. Same way, say for example, we are larger species, we have more blood volume in us. So when we actually take any drug, and suppose we are a part of a pharmacokinetic studies, then we can withdraw a lot of blood from a human being because there is a lot of blood inside. Even when we go for a blood donation camp, we give almost 500 ml of blood from our body, right? 200 ml, because the total blood volume is more. So same way, species like animal species are smaller, so their blood volume is also, total circulatory volume itself is less. So we cannot really drain them out of entire blood. In other words, if I take more blood than the recommended blood volume, then the data which I'm getting from that study will start compromising. It will not be reliable. So we have to follow the recommendations by CPCSE and other guidelines for withdrawing the blood volume. So we'll talk about that. As you can see, orally, we give oral gavage, basically using a syringe and a stainless steel intubation tube. We give the oral gavage because we can hold the animal, as I said, with a skin between 2 ears and thumb. You can take it on the other side, I mean, flip it around, and then intubation tube can pass through their epiglottis kind of thing and directly into the esophagus. So that is called oral gavage. So that is also how you can give for mouse. The dose volume defined is 10 ml per kg body weight, right? Rat it is 10, rabbit it is 10, and dog it is 5. So for higher dose volume, suppose you want to give higher dose volume than this. So what you need to do, give them fasting. As I was mentioning, animals are always given ad libitum feed, that is sufficient feed which they can eat. But sometimes we can provide them with fasting conditions also if you want to give them more dose volume. So large dose volume overload the stomach and pass immediately into small bowel, and large volumes may reflux into esophagus. So you see, if you take large volumes without keeping them in fasting, then either it will go to small bowel directly, it will be coming out of the body, or it may regurgitate and reflux back to the esophagus. So to avoid that, we should be strictly within the range of recommended dose volume species wise. So roots, just for oral, parental root. Parental root means any root except for oral. We give parental roots, especially intramuscular, intraperitoneal, and intravenous. So factors we have to keep in mind while deciding these other routes of administration: the dose volume which you need to administer, the stability of your formulation. Sometimes we give it intravenous in rats and mice through tail vein, and immediately the formulation crashes as soon as it comes in contact with plasma, right? So we have to keep that in mind. In other words, we have studied the plasma stability, right? So the moment your drug is a substrate to hydrolases or esterases which are already available in plasma, it may immediately degrade. So we have to keep that in mind while deciding the parental route, right? So dose volume and stability. The pH, of course, we cannot give an acidic pH because the blood pH 6.8 to 7.2 kind of thing, right? So you have to maintain the pH also accordingly. Otherwise, an acidic pH again will not really work out for you. Again, the viscosity. If it's an oily formulation, it will be very painful if you try to give it through intravenous. So all those things also decides the route of administration. Sterility, because it is getting into your intravenous system directly into your circulatory system, it needs to be sterile. If it is not sterile, the contamination can directly go through your circulatory system, and you may suffer from toxemia or septicemia, right? It should be biocompatible, right? The needle size, the bigger the needle size, so it would be very difficult to really stop the bleeding after you take out the needle. So needle size also try and take as much small as possible, so that you don't, because generally, suppose in human, this is the, suppose I'm giving the intravenous here, so the needle size should be small enough so that slowly you can push the drug against the gravity, right? Speed of injection, as I was mentioning, always, sometimes we give a bolus injection, sometimes it is an infusion. So based on that, bolus means at a time it is delivered, and infusion means with that bottles, over a period of time, like say a few ml per minute, administration goes away, or per hour. So like that, that bottle can dispense entire drug over a period of time. So that is infusion. So all these are the factors which decide the parenteral route. What are the other route? Subcutaneous. So as you can imagine, subcutaneous. So when we use, well, substances that needed long absorption time. So generally, I would say, in very easy example, in human people who suffer from type 1 diabetes, they generally take insulin shots, right? So they have to take insulin injections subcutaneously. So why do we take subcut injections? Because it gives them a time for delayed absorption, a long prolonged absorption. So subcutaneous is a better site. Why they don't take it orally? Because it is unstable in acidic and intestinal pH. Why they don't take intravenously? Because it half life is hardly a few minutes. So you see how much insulin you have to give intravenously, because half-life is too less. So the best way is to give is subcutaneous. So many patients, they themselves can take subcut injections at home before meal. So by the time they complete their meal, there will be sufficient insulin release available in the circulatory volume, which can reduce the hike in glucose for type 1 diabetic patients. So what is the dose volume if you want to give subcut? In mouse, up to 10 ml per kg body weight. In rats, 5. Rabbits, it is 1. In dog, it is 1. So higher the species, lower would be the dose volume, especially for subcut. Intraperitoneal. So basically in the peritoneal cavity, you have to give this. So it is not like intravenous, where it directly gets into the circulatory system, but it is in the abdominal cavity, the peritoneal cavity, which is evidently supplied with the blood supply. So the kinetics it follows is very much like intravenous. After initial 5-10 minutes of delivery, it follows same kinetics of distribution, metabolism, excretion as any intravenous route drug, any intravenously administered drug will follow. So that is intraperitoneal route. And one second, if I can show you the picture. Yes, when you hold this is the site basically. You have to just take a flap of skin, pull it towards your side, and then put an injection. So it will directly get into the intraperitoneal cavity, peritoneal cavity. So that is the site where you give the intraperitoneal injection. Lift the flap of the skin, give it inside, push your needle inside, and then look for the pressure. Some pressure should come, and then you should administer the drug. So again, what is volume? For mouse, it is up to 20 ml per kg. For rat, it is 10 ml per kg. For rabbit, it is 5 ml per kg. And for dog, it is 1 ml per kg. Okay. So what is the other route? It is intramuscular. So sites needs to be chosen to minimize the possibility of a nerve damage. Yes, of course, because we want to make sure that a lot of nerves also passes through the muscles. So you don't want to go so deep so as to damage any nerve. Okay. So what happens is the subcut is the slowest absorption. Intramuscular will have a rapid absorption compared to a subcut injection. Okay, the site should be rotated for multiple dose studies. Sometimes we have to give multiple dose in order to avoid further pain. Sometimes you may give it at the same site, so we keep on changing the sites of injection. Same is the case for lab animals, same is the case for human. Sometimes we take it on shoulders, on left shoulder, right shoulder, on our buttocks. So these are all the different sites for intramuscular. For mouse and all, also you can change the legs so as to avoid the repeat administration on the same site. Okay, so usually it takes around 45 to 60 minutes for absorption. Okay, and it is stored there. It takes long time to be released from the muscle site. So what is the dose volume? 0.05 ml. You see, per site, not more than 0.05 ml. In rat, not more than 100 microliters, right? In rabbit, 250 microliters. In dog, 250 microliters. So you can see based on the surface area, clearly you can see the with increasing the species, the dose volume also increases. Intravenous, as I said, bolus means over a period of 1 minute, entire drug would be administered directly into the intravenous. In slow intravenous injection, same injection very slowly up to 5 to 10 minutes. And third category is intravenous infusion, where 10% of the circulatory volume over 2 hours, you are replacing it with your intravenous infusion. So that is three ways intravenous. You can give bolus immediately, less than a minute, up to 5-10 minute delayed slow injection is slow intravenous, and then through intravenous infusion continuously it will be administered. So in mouse it is 5, rat it is 5 ml per kg for bolus. For rabbit it is 2, and for dog it is 2.5. Bolus, as you can see, we are giving immediately within less than 1 minute, so it is less. But if you want to increase the dose volume, always prefer to give them by slow injection or intravenous infusion, where definitely you can give more dose volume in different species. Next route is intradermal. Okay, so assessment of immune and inflammatory or sensitization response. When you try to do, we try to do using intradermal injections. So what are the volumes? Up to very less, 0.05 to 0.1 ml can be used dependent upon the thickness of the skin. Okay, thickness will vary from dog to rabbit to mouse to rat to human. The thickness of skin will vary. So the most common site is back or abdominal skin. Hair must be removed at least 1 day before the injection, and then you can give it. You can always see, you will find some pressure when you try to give it intradermal. Back pressure will come on your injection, means no blood should come, but a back pressure will come, means you are in a right site. Small blab after injection confirms the right ID injection, because it is giving just below the skin intradermal. After you give, initially it doesn't move. It will form a depot, slight swelling depot right at the site of injection, means it is a successful intradermal injection. With time it will subside. So let's move. We have seen the different routes of administration in animals. Now let's see in terms of blood sampling, where do they stand? So circulating blood volume in laboratory animals. So we have seen in mouse the circulating recommended volume is 72 ml per kg, right? This is how much volume is available. In rat it is 64 ml per kg, rabbit it is 56, and dog it is 85 ml per kg. So how much recovery periods you have to give? Okay, means we have seen in this slide, we have seen what is the recommended circulatory blood volume ml per kg for each species, like 72, 64, 56 per kg ml per kg. Now we are seeing how much of the blood volume can be removed. So what we say, please remember, make it by heart. Answer is 10%, but generally we say if you stay within the range of 7.5% of the entire circulatory blood volume, you can withdraw. Okay, not more than that. So for example, if the total volume is say 10 ml in a rat, then you should not take more than 1 ml or more than 750 microliters of that. Suppose you have taken 7.5% of the blood volume, then you have to give them 1 week of recovery period. It will take 1 week in order to again form same amount of blood, means whatever blood loss has happened, to recover from that, animal needs at least 1 week. If you take 10% of the circulatory blood volume, you withdraw, then you have to give them 2 weeks of rest. If you take 15 ml, I never recommend this, although, but it is mentioned. If you take 15% of the circulatory blood volume, then it needs 1 month. The animal needs 1 month to recover from that. Suppose this is, I'm talking about single sampling means at one go you have collected 7.5% of the entire blood volume, or 10 or 15%. Suppose same thing you are collecting over multiple sampling, like I have taken 50 microliter, after 10 minutes I have taken another 50 microliter, after 15 minutes I have taken another 50 microliters or 100 microliters, after 1 hour, 2 hours. So if it is a repeated sampling over 24 hours, if you're taken 7.5, then it needs 1 week. Between 10 to 15 ml percent of blood you're taken, then it needs 2 weeks. And if you need 20 ml, if you're taken, then you need 3 weeks for recovery. So after this, animal will have same amount of blood again in his body and sufficient washing period. Now you can easily use the same animal for testing some other drug. Okay. So this is the recommended bloods. As you can see, for a mouse, what is the blood volume? 1.8. So at 7.5%, you should not collect more than 100 ml, 100 microliter, right? For 10%, not more than 200. For 15, 0.3. For 20, 400 microliters. For rat of 250 gram, total volume is 16, not more than 1.2 ml. 1.6, 2.4, 3.2. Like rabbit, 17. For dog, it is 64. So I would generally recommend, although as per guidelines up to 10% you can go, but now even the instrument with advancement in technology, in instrumentation, you can very well quantify the drug with smallest possible blood sample. Nowadays, even for biochemical analysis, instruments are in automation. Automation is possible, and they are so sensitive instruments that hardly few microliters of sample will do. So you can still do PK study or a toxicity study using very minimal blood collection, right? So as per the guideline, it is 10, but I always say for a good welfare practices, and if you have a possibility of doing micro sampling, or you can do analysis by dry blood spot, where just one drop of blood can help you quantify your drug, then please take as less as drug possible. So please, whenever you do a PK study or a toxicity study or sometimes an efficacy study, drug withdrawal, please be in this range. Which is that range? 7.5% of their total blood volume. So please remain in that range. Then your animals would be completely fine and healthy, and the data which we get is highly reliable. Okay, and you can use the same animals after some time, after some washing period, after 7 to 10 of their half-lives. You can again use the same animal. So please, by heart this table, be on the 7.5% side rather than collecting more blood from a welfare point of view or ethics point of view. As you can see, summary of advantage and disadvantage of various methods of blood sampling. So you see in different species, jugular, general anesthesia required? Answer is no. Cephalic, no. Syphilis, no. Marginal ear veil, no. So, see, for rats, dog, and rabbit, jugular is the best way. For jugular, of course, for rats and all, we have to do a jugular cannulation surgery. But the tissue damage is minimal. Repeat bleeds, you can do it, and you can collect more volumes easily. With syphilic, same is the case. With tarsal, same is the case. With marginal ear, which is the most common blood collection site for rabbits and of course mini pigs. In India, I don't think mini pigs are being used, but rabbits, yes. The marginal ear is the best site of blood collection for rabbits. Again, you don't need any anesthesia. Sometimes people have applied local anesthesia, but otherwise you don't need any anesthesia for collection of this blood. Very minimal tissue damage, and you can do repeat bleeds, right? Femoral, in the hands it will be there, sublingual, under the tongue, lateral tail. This is for rats and mice. As you can see, rats and marmoset, macaque, rat. So you can do, but then there in all this thing the tissue damages are minimal. So please always follow this route of administration or collection as long as it is possible for blood sampling. Correct. Actually, I have done earlier during my initial phase of my career using tail tips also, because we used to cut the smallest piece. So very moderate tissue damage would be there, but you get 1 or 2 drop of blood which could be sufficient. So repeat blood may not be possible because that you have cut the tail. So now you'll have to put another cut. So that used to be a disadvantage, but it was a very easy way of collecting the blood in case of mouse, especially mouse, not rats, but yes, in rats also it can be done. Many colleges, many institutes, they are still following retroorbital flaxus. So in retroorbital flaxus you got two sides, one is the anterior and the posterior side, and you can really break the microvasculatures there with a glass capillary tube, and you can collect the blood, and huge volume of blood can be collected, but it is a permanent damage to the tissues, it is moderate or high damage, right? So general anesthesia, yes, it is required because it is very painful. So unless animal is anesthetized, it won't allow you to prick the eye with a glass capillary. Nowadays, hyperonized capillaries are available, so there won't be any clotting. And you can, of course, collect multiple sites, but by and large, people say that as long as you can stay away from retroorbital flaxus, that is good. Although it is most widely practiced method of blood collection in lower species, especially mouse and rats. Okay. So, what are the recommended sites? As I already mentioned, but separately for mouse, it is syphinous lateral tail vein from the tail you can collect. From rat again, even sublingual below the tongue also is a very huge vasculature available. You can collect from there. Rabbit, the best site is marginal or central ear artery. Dog, jugular or cephalic or syphinous. Okay, so that's about recommended sites for blood sampling. Okay, so as I mentioned, the take-home message for this would be that please always be on the side of 7.5% at the most of total blood volume you should plan to collect out of any efficacy, toxicity, or PK study. Okay. I think we still have time, so let me cover a few slides on toxicity studies, and then we may stop. Okay, so I'll just take a small break for a sip of water. Yeah. So about toxicity studies, the acute toxicity studies, as the name mentioned, they are small duration, short duration, less than 24-hour treatment, generally single dose. It is called acute toxicity. For subacute, anywhere between 24 hours to 30 days of treatment if you are doing, then subacute toxicity studies, right? Subchronic, it could be anywhere between 30 days to 90 days repeated dose treatment, which is subchronic toxicity study. And a chronic, it is always treatment of more than 90 days. So in toxicity study, friends, you will always come across these four terms. So I'll spend a few seconds on this slide. Acute toxicity, subacute, subchronic, and chronic toxicity. How they are differentiated from each other? From number of duration of treatment. If it is single dose, generally less than 24 hours treatment, we call it as acute toxicity. If your treatment period is from 24 hours all the way to 30 days, we call it as subacute. When it is from 30 days to 90 days, then we call it as subchronic toxicity. And chronic are the long-term toxicities up to 6 months. Anything above 90 days of treatment of any drug candidate, we test the chronic toxicity. Then some specialized toxicity studies we come across like neurotoxicity, immunotoxicity, genotoxicity, and reproductive toxicology. We'll talk about it. So when you say acute oral toxicity, okay, so I want you to make a note of it. Please go through OECD 420. So when you type on Google OECD 420, it will open up a document which will talk about fixed dose acute oral toxicity study. When you open a document OECD 423, it will open acute toxic class method. Up and down method is mentioned in OECD 425. So basically, these are OECD guideline documents which tells you how many animals to use, what dose to use, how many groups to use, and other parameters. What are the endpoint parameters for your toxicity study? Everything is well defined in this guidelines, and you can easily follow that and do your study as per the OECD guideline. Okay, fixed dose, acute toxic class method, up and down method. So what does basically acute oral toxicity does? It determines the range of exposure where lethality is expected, right? It provides information both for hazard assessment and for hazard classification. So we always have to do an acute toxicity because it will help you to select the dose for repeated dose toxicity. As I mentioned, it is a generally a single dose oral toxicity study. So the data which we obtain will really help us define the selection of doses, what we need to select going forward for repeated dose toxicity studies. That's why acute oral toxicity study always needs to be done. Repeated dose toxicity, it will actually evaluate the adverse effect as a result of repeated oral administration for subacute, subchronic, or chronic duration. So as you can imagine, more than 1 day, so it can be subacute, up to 30 to 90 days, it could be subchronic, or more than 90 days repeated administration could be chronic duration. So during this chronic, subacute or subacute repeated dose administration, what all adverse effects we are seeing will tell you the that is what we study in repeated dose toxicity. Okay, to get information on major toxic effects. So basically, since it is repeated dose toxicity, we imagine and we anticipate that if there are any target organ toxicities, there are any possibility of drug accumulation in any part of the body, we can find out, and an estimation of dose to conduct the long-term toxicity study. So all these three major information we get from the repeated dose toxicity. You should also, whatever dose we are using, we want that from this we should be able to arrive at no observed effect level, of course, and no observed adverse effect level. Even this can be determined from this, right? What is a carcinogenicity study? To determine the carcinogenicity effect, carcinogenic potential of a test substance following prolonged and repeated dietary exposure. Okay, so that is the meaning of carcinogenicity study, right? To determine carcinogenic potential of a test substance following prolonged and repeated dietary exposure. Okay, dose levels, by and large, you should always have a control. Yes, because without control, we cannot compare the effect, the toxic effect which we may get. While you select the doses of your drug, always try to have three doses. One would be the low dose, one would be the mid dose, and third would be the high dose. To assess the reversibility, apart from this four, you should have other two groups also. Why? Because we want to see the reversibility or persistence or delayed occurrence of toxic effect. What does it mean is, suppose if I am doing chronic, say subchronic toxicity studies. So the dosage duration is anywhere between 30 days to 90 days. Okay. So after say for example, I have selected 90 days. So up to 90 days I have given. Now I stop giving them the drug. What if there is any toxicity, and is it going to be reversed after this? You got my point. After I have stopped giving the drug, say after 10 days, after 1 week, after 2 weeks, after 3 weeks, are those effects being reversed? Okay, or I have seen any toxicity, are those effects continued even after discontinuing the drug? Or the third thing is, after discontinuation of the drug, are there any delayed occurrence? Are there any effects which have come up very late after even discontinuing the drug? So those three aspects can be studied. So we maintain two more groups. One of them would be controlled recovery and one of them would be high dose recovery. So this too can be maintained. So the doses which we use in toxicity study would be control, load, mid, high dose, control recovery, and high dose recovery. Okay. And general, again, we will definitely get into detail of exactly how they are being done. But in general, the observations which are covered in a toxicology studies are clinical signs, which on a daily basis you can observe, right? On a daily basis, you can check the clinical signs. If at all there are any changes, it can be recorded. Twice a day, you should look for mortality. Suppose if animal has died, you can immediately make a note of that. If morbidity means if they have become lethargic, then also it could be an effect of your drug. On a weekly basis, we take the body weight of all the animals from all the group. So that will tell you if at all there are any effects on body weight gain or body weight lose, or whatever body weight they have lost. So even that can be recorded. Okay. Eye examination, pre-treatment and pre-sacrifice means before starting the treatment you should look for the ophthalmologic. So there is an ophthalmoscope for their eye. You can look for the changes or the condition, and after your study is over, generally after the last administration treatment, 24 hours after that we sacrifice the animal. Before that you should do the ophthalmic examination. On a weekly basis, make note of the food consumption. As I said, in a cage you can keep 3 or 5 animals, so you can always weigh the feed and give them the feed pellets in the cage. And next day when you collect the leftover feed, that can be weighed, you subtract this, you get the daily intake. So on a weekly basis we can monitor the food consumption, whether it is increase or a decrease. You can look for any observable effects. Okay, any terminal effects are there, even those can be seen, right? Hematology, these are always terminal because we sacrifice them, collect the blood and look for the enzymatic characteristics of hematology. Even clinical chemistry, this can be done, always terminal from the blood which we collect. You can collect the urine on the final day and we give for analysis. And finally, gross and histopathology. So you have to actually cut open the animal, okay, and then look for all the tissues, okay, organs grossly. And when you collect the organs, store them in 10% formalin, and later on you can prepare slides out of it. And at a cellular level you can look for if there are any changes in control versus the treatment groups. So these are all the general observations which are done and with their frequency. Okay, so clinical sign, morbidity, mortality, body weight, eye examination, food consumption, NBO, FOB, hematology, clinical chemistry, urinalysis, and gross and histopathology. So these are the general observations. Okay, so always remember, from a CPCSA guideline point of view, it's not that sometimes in colleges I have seen, even in some of the companies, they try to overcrowd the animals. Please never do that. Try and follow the minimum space requirement. For a rat, if the body weight is this much, this is the floor area requirement. This many number of animals you can keep, you see, and this should be the dimension of the cage. It is so precisely defined, so it's very easy to follow. Even there are vendors available. I'll talk about it later. The major few vendors who are there operating in India in different states, they provide cages of all dimensions as per CPCSA guideline. Suppose if your body weight falls in this range, then this is the floor space requirement. Then you can keep, as you may very easily correlate this, more the body weight, lesser is the animals you can keep. As simple as that. More than 500 grams of body weight means hardly you can keep 2 animals in one cage, like that for rats. For mouse, again, if you have higher the body weight, more than 25 grams, then not more than 6 animals can be kept. But if they are below 10 grams, then you can keep as 16 animals in that same cage. Although it is not preferred, but this is, you can keep if sometimes there is a space requirement, right? Same way, up to different, from 15 to 25 grams, you can keep 13 to 8 animals per cage, right? And this is the dimensions of the cage. So like that, it is very well defined for rats, mouse, guinea pig, rabbits. Everything is defined in detailed manner in CPCC guidelines. So you can always follow minimum space requirement as per CPCC guideline. Okay. So now, just to give you a very snapshot review that, okay, once in a discovery phase, we do a lead selection. Once you have the lead identified, the molecule we optimize, then it gets into preclinical candidate. We go for IND. We get a permission to do first in human, then we do phase 1, phase 2, phase 3. We apply for new NDA application, right? And then finally it gets approved. So this was the process which we started our lectures from. And now you see soft spot and reactive metabolite analysis, all those things using in vitro studies or in silicos can be done in discovery phase. Species comparison in vitro to in vivo. So as we have seen, hepatocytes, enterocytes from rat, mouse, guinea pig, from dogs, monkey, human can be done at this stage where that is slightly overlapping. You can do, of course, in silico, but you can do in vitro also, and in preclinical you can do in vivo animal experimentation. So that happens in this phase. Rapid screen, if there are any drug-drug interaction potential of the drug, it happens very early in discovery phase, where, as we have seen, we look for CYP induction or inhibition or reaction phenotyping studies. While in vivo testing, we always do ADME studies, PK studies, we talked about it. We do definitive in vitro CYP inhibition, induction, all the in vitro assays. Here we'll be doing in vivo testing in animals. So you see where all they overlap. So why I put this slide is to make you aware of how we have covered different topics, especially based on its relevance to drug discovery and where they apply. You got my point. So we can do in vitro, in vivo during discovery phase. All the in vivo studies we can do preclinical development, and finally in clinical development we do ADME studies, even some tissue distribution and clinical drug-drug interaction studies in clinical development. And then finally, lastly, once it is launched successfully into the market, we do post-marketing surveillance drug-drug interaction studies. Okay, so that is the whole gist of where the different studies are being done, and how they are applied in different phases of drug discovery. Okay, so in nutshell, discovery, basically we try to do refinement of the molecules. Okay, we just one second. Yes, I'll go back here. So we can do the refinement of the chemicals, right? So thousands and thousands of molecules we are dealing with. So now we compare the properties from a safety perspective, from their metabolic liabilities and their structural liabilities for ADME improvement, and we do refinement. So as it is rightly said, chemical and biological characterizations we do, and then the safety and toxicity in animals. So of course in animal species we do, and based on that, suppose if there are any PK related issues, then we can do development of the formulations accordingly. Finally we go to the human, where we do the clinical trials and the patient studies. Of course in phase 1 it is all the healthy volunteers. Phase 2 and 3 always done in the patients, and the entire studies are done in a regulatory environment, because those studies needs to be audited by FDA. Finally, what all approvals we get, they are marketed, launched, and post launch, whatever lessons are learned, that are then applied for the drug discovery. So this is the whole drug discovery development process, and application of in vitro followed by in vivo testing followed by human clinical trials at different phases of drug discovery and development. So I think I will stop on this slide, because it's already close to 2 hours, and then maybe remaining topics we take in tomorrow's slide. and this just last slide I'll cover so that then I can stop here. So this is where we talked about. Hello,
Sir, you can.
hello.
Sir, you can, sir. It's
Yes, yes,
audible.
yes, 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 yes. So I will. Hello. So I will. I'll cover this last slide. Maheshwari, a lot of background is coming from your side. If you can
Yeah,
just
one
mute.
minute, sir.
Yeah. So yeah. So I'll just complete this last slide and then I'll stop.
Yeah, okay.
Yeah, so this is the last slide. Why I have kept is to showcase the correlation, right? We have covered this when we were talking about in vitro assays, but now we have talked about in vivo studies also. So now it will make more sense. So I just kept this thing here. So when you do say in vitro animal studies, okay, which are generally done in mouse, rat, monkey, dog, hepatocytes, okay, or enterocytes, then we can extrapolate the data to get the same species prediction for PK parameters in how it look like. We can do from that, or we can do an actual in vivo live studies in animals, and that correlation what we make is called IVIVC, right? From same animal species we can extrapolate and in vitro human studies, how it looks like, or we may do in vitro human studies. You don't need much permissions, you can actually perform those studies, and then we try to predict what is going to be the outcome in the human. You got the point. So in vitro plays a major role because you extrapolated in vivo parameters from that, and from that you try to predict, or sometimes we can actually do in vitro human studies and then try to predict what is going to be the outcome, the clinical outcome of this molecule. So the prediction comes from in vivo animal studies, prediction comes from in vitro human studies, and then we try to closely predict the parameters of PK studies in clinical environment. So that is the model for in vitro in vivo correlation in preclinical species combined with human in vitro studies. So somebody's asked me this question during initial class that the prediction is not good, but prediction can be good if you use in vitro animal studies, in vitro studies, and in vivo studies in animals plus in vitro human studies. All these three things together, if we put that data and try to predict something for human clinical outcome, then the correlation would be better. I guess so. That is the reason IVIVC is also very important. Okay, so with that, I think I will stop here, and would be more than happy to take up any questions we may have. So let me just stop here then. Okay. I'll see very quickly. We'll take one or two questions, and in remaining questions, I'll try to answer it back in tomorrow's class. Okay. So let me switch on the video here. Yes. So we'll be open for any questions if you may have. Thank you.
Yeah, sir. Sir, some questions I have put in your chat box, please.
Okay. Let me read that. Yeah. Okay, so what is the main role of ethical committee in clinical trials on animals? Okay, so first thing, when we do a trial in animals, it is called preclinical studies. Okay, it's not called clinical. We call it as preclinical studies in animals. Uh, and the role of ethical committee is very important. As I said, any project, any protocol, or any proposal where you have animal usage. Okay, suppose I want to do a PK study, so I would say that I want to do by two routes, say intravenous and an oral administration. In each group there will be 10 male and 10 females, so in total 40 animals. So I'll have to now give this justification. I mean, I have to fill out a form which is called Form B. It is readily available on CPCSA website. So I'll have to put out all the details in there, and then IAC, Institutional Animal Ethics Committee, will review that, and what do you call, it will see the justification that can I really uh, manage by using less animals, okay, rather than 10 male and 10 female. Why do I need that many animals? If statistical data can be generated out of using 6, why I want to use 10 animals? Just I'm giving you an example. They may ask you that question, and I have to answer it from a guideline perspective. I can answer, justify the usage of animal from a scientific perspective, and if the committee is convinced, then they may approve the usage of animals. Otherwise, they will recommend that okay, you reduce number of animals in a group, and I may have to reduce the number of animals, or they may outrightly reject that okay, this is not your final molecule, so maybe the answer which you're trying to find, you can do some in vitro studies. So this study can be avoided. So in that case, they may reject. So generally, they don't reject. But yes, if it is completely scientifically unjustifiable, then they have every right to reject. They can easily reject the proposal. So the role of ethical committee is very important. I mean, any study which involves laboratory animal usage needs to be run through institutional animal ethics committee. Otherwise, it is never going to uh, it is never going to be allowed to use the animals. So IAC is very important. Without their approval, you simply can't do. And if you many times when you publish the articles, generally they ask for the IAC approval also if you used animals. So without IAC approval, you can't do the study, and if you have done the study, that data won't be accepted. So when we submit the data, I think for any client or for any project, IAC approval form should also be attached there. So even when we write the report, we write the article, you read any article, it will be mentioned that it was animal ethics, IAC approved protocol was used. So IAC role is very important. Without that, they cannot allow you the usage of animals. Okay. All right. So my question in the last class: how clearance is calculated in uremic patient? Okay. So this is in uremic patient. So it just missed out. So I think I will note it down. Uremic patients. Okay. Typically, let me just see. This is a very specific case asked. So let me just look into that. If there is a uremic patient, is there any way we can put that factor into clearance calculation? I will look into that and come back. How dose and dosage regimen is calculated in uremic patient? Okay, so it's completely related to that. I will cover if it's a uremic patient, how really clinical dose can be calculated. How animal studies will be carried out for cancerous drugs. Okay, so for cancer drugs, you have to do cancer. You need to use cancer models. Okay, so in other words, see, there are different kinds of cancer. So in animals, when you try to do, first you have to select a species where the same cancer can be induced. Okay, so you cannot go and find a cancerous species of rats or mice, but we have to induce those same cancers. So those cell lines, you have to identify which cancer you want to really induce. You have to inject those cell lines into the animals, and you can generate the tumor model in the animal species. Okay, now what happens is the first reaction of body is to reject excuse me, be it animals or human. So if you take a normal rat and try to inject them with a cell line, their own immune system will reject, and the success of tumor model would be very minimal. So in that case, there are specific strains are available, as I mentioned, severely compromised immunodeficient mice, or in other words, we call them as nude mice. Okay, so these are animals where there is no immune system at all. There is no thymus. They are completely devoid of any immune system. So of course they are special animals, right? Because now they are prone to any infection. Even forget about cancer cell lines. If your room is not sterile, they can get any infection. So these animals needs to be maintained in either individually ventilated cages, or you can put a conventional cage system into a isolator. So as I said, generally we say animal facility rooms are class 1 lakh, 0.5 microns, but especially for nude mice, we keep them further, they are class 10,000. So basically, I mean, in a class 10,000 facility, so another barrier of HEPA filter you have to keep. So either you should have an isolator, where if you would have seen, maybe I will try to show you some pictures in next class, how an isolator looks like. So there will be an extended arms of an isolator, so you have to wear gloves, and then with that gloves you have to put that into the arm, and then only you can handle the animal, just like a biosafety cabinet kind of thing you imagine. And inside that you don't have a direct access to animal, so that they are safe. So you have to use such facility and such animals. So now, as I said, there is no immune system. So when you inject a cell line of our preference, they will accept that, and over a period of time, slowly that tumor will form in their body. And once the tumor is has reached the significant size, which as per our protocol, then you can start the treatment of animals. Of course, sometimes you can start treatment, you can have different groups. In a group of animals, starting onwards, you give the treatment. In few animals, after the tumor volume has reached a certain size, you can weigh using a vernier caliper, and then you can start the treatment, and then look for how the tumor regression is happening, right? And once the treatment is taken back, I mean, is stopped, after some period of time, does that tumor again forms, because that is very important. When in chemotherapy, we want to see, right, that eventually after the chemotherapy sessions are over, does this uh, tumor can form again. So we want to see that also. So those all groups you can form and test it. But very importantly, for your question, for cancer drugs, you have to use nude and skid mice. They are immunocompromised mice, so whatever cell line you inject, they will have an organ specific tumor can be formed, and you can then test your drug. They are very specific studies, and it takes some time to standardize that, right? Because as I said, any mishandling, animals will die. So you have to be very careful when handling those animals. So you need some practice to really handle nude and skid mice. How ADM is carried out in infants and neonates effectively, as their organs are not completely developed. All right, so this is interesting. So I guess this question was also asked last time, and I didn't answer that. So let me work through this and get you an answer. That, see, a uremia patient, so we are saying a specific condition, right? Same way, we are saying neonates, where again their organs, especially liver, kidney, may not have really developed completely. So how exactly the ADME will be impacted? Let us understand that in a separate class, okay? In 10-15 minutes of discussion, I'll answer both these questions in detail. Okay, for uremia, of course, I will have to look for, and since it is related to same, I will answer this question also there. Okay, so interesting, and then thanks for such very relevant questions, and we will discuss this definitely. Okay, so hope all the questions are answered, and I don't know if time permits or not, but I will try to cover some cancer models if possible, at least for the if people are really interested. And I'll definitely share a picture of isolator, and how animals are nude animals are actually they look like, and how they're handled. That definitely in subsequent class will cover. In fact, during this last 2 week, last couple of days of holiday, I was just thinking that one of these days I will, I don't know how I'll do it. I'll work with Maheshwari and see to it if it is doable. I'll try to walk you through an animal house. Okay. So just to make you, of course, many of you would have already seen an animal house, but just to show you a traditional animal house facility, CPCSA approved facility, I'll walk you through live if possible, and so that you can see the different types, different rooms, the infrastructure, temperature, humidity, or maybe the flooring, epoxy flooring, and the HEPA filters and all those things, HVAC and all you can see. So at least it will give you an idea about an animal facility. So I'll work with Maheshwari and I'll see if we can do a live walkthrough in a facility. If that is doable, I'll show you that as well. Okay. So with that, let me just stop here and thank you for sparing your precious 2 hours for this lecture, and we'll connect again tomorrow, same time, 11 o'clock, and then we'll take it further from there. Thank you.
Thank you so much, sir. Students, I have given the feedback form in YouTube and Facebook also. Please check it and submit the feedback form. Based on that only, we'll provide the certificates. Thank you, sir.
Thank you, Maheshwari. Thank you.
Thank you so much. Thank you, students. The section was closed.